Time now for our medical moment. Today we're talking about the COVID-19 vaccine and children. The FDA just expanded eligibility of the Pfizer vaccine to children ages 12 and up.
Today our guest is Natalie Fox, who is a pediatric nurse practitioner with USA Health. Natalie, this is breaking news. This just happened within the last hour. Tell us, do we need to vaccinate our children?
Absolutely. I'm thrilled with the news from the FDA. It is something that we have been anticipating for the past several weeks, especially Canada took the leap last week. And again, thrilled with the news. And yes, I'm looking forward to moving forward with vaccines for those 12 and up.
Natalie, is this vaccine safe and effective for children?
Yeah, so the clinical trials demonstrated that it was very effective. In fact, it was 100% effective in this age group. The trial enrolled around 2,000 adolescents between the ages of 12 and 15. It was part of the larger clinical trial that included other ages. They found no serious adverse effects. The side effects that they did see were the same that we are seeing in other populations, which are those self-limited side effects, soreness and pain at the injection site, fever, headache, malaise, all of those things that resolve in 1 to 2 days. And we know that those are going to resolve. What we don't know are the long-term effects of COVID, specifically in the adolescent age group. You know, in our health system, we are seeing COVID admissions in adolescents. We are seeing the multi-inflammatory syndrome in children, known as MISC, that affects multi-systems, including their heart, their brain, their organ, that can have long-lasting effects. Again, so this is great news for adolescent patients to be able to have that extra added layer of protection.
And so I plan on getting my son vaccinated for sure this summer. He is 13. What will this mean for children as far as quarantines go? Because I know a lot of schools are forcing the quarantines if there's someone in your class who has COVID or at your table or your sports team. Does this mean you won't have to quarantine?
So we're going to see some more guidance come out now that the FDA has approved it from the CDC, specifically from the Advisory Committee on Immunizations. And I imagine that we're going to see the same thing that we see for adults that are vaccinated, meaning that if you've been vaccinated, fully vaccinated, so in the case of Pfizer, that means 2 doses, 21 days apart, and it's 14 days after that second dose, that if you have an exposure, if you stay asymptomatic, you will not have to quarantine, is what we expect to see.
Natalie Fox, thank you so much. Natalie Fox, nurse practitioner with USA Health.